The counter argues that we need to address the addiction itself. However, the safe injection sites are often set up to promote treatment and rehabilitation in every way possible. Many safe injection site facilities offer both services to prevent overdose and services to treat addiction and rehabilitation as they accumulate their way into a sober living. Another main point of the negative is that there are other ways besides safe injection sites, such as targeted naloxone distribution to high-risk population areas. This is only effective when combined with the proper education on when and how to use the medication. Naloxone, which is the generic name for Narcan, is also readily available at all times and is frequently prescribed to those with a substance use disorder for emergencies, even from places like safe injection sites who offer treatment services. Another point was that medication-assisted treatment such as Suboxone is also possible in addressing the opioid epidemic. However, there are many programs that are outpatient and address addiction or substance abuse disorders. These outpatient facilities require strict regulations and policies in order to maintain the program, and oftentimes, if there is continued use of the illicit drugs, they are removed from the program out of their own will. This puts them at substantial risk for overdose and mental health disorder or even an acute mental health crisis. Many safe injection sites don't require abstinence or sobriety in order to benefit from the facilities. Many safe injection sites are the most flexible options in terms of managing the disease, and that's why they're so important to have access to. It's because they're readily available to anyone. An article from 2021 titled Supervised Injection Facilities as Harm Reduction, a Systematic Review, writes that, quote, the strongest evidence suggests that SIFs, supervised injection facilities, may help reduce overdose morbidity and mortality and improve access to addiction treatment. An increase in crime, an often cited concern of SIF opponents, was not observed to be associated with SIFs in most included studies, and crime was actually found to decrease in 2 studies, unquote. At this point, the research states that the benefits of safe injection sites are proving true, which is less harm. An article from the American Family Physician Organization from 2022 states that, quote, supervised injection sites improve health outcomes. One study found a 26% net reduction in overdose deaths in the area surrounding a supervised injection site in Vancouver, Canada, compared with the rest of the city. A supervised injection site in Barcelona, Spain, was associated with a 50% reduction in overdose mortality from 1991 to 2008, unquote. The risks are being proved to not be directly connected to the safe injection site facility. Why not encourage and promote the facilitation of this new developmental idea of supervised injection sites? Furthermore, that same article from 2022 states that there are other ways safe injection sites provide benefit, as they write, quote, people who inject drugs are significantly less likely to share needles if they use supervised injection sites. These sites could be effective in reducing the rates of HIV and hepatitis C in people who inject drugs. Supervised injection sites can also reduce the number of publicly discarded syringes, and they improve public safety, unquote. The main goal of all those in this discussion is the safety and well-being of the public health and the safety of our civilians in this country. This includes those that are troubled with addiction or substance abuse disorders. To deny the benefits of safe injection sites is to deny those who struggle with substance abuse a chance to living a healthier life and benefiting the public surrounding it.